Well, new concerns this morning over whether Americans' diets are fueling health problems. A Washington Post report notes that a growing number of children are actually getting kidney stones, and experts warn it's only getting worse. Ultra-processed foods cited as a major culprit. Other experts trace the increase to genetics, poor diet, and insufficient water intake. We welcome now Dr. Dave Montgomery, board-certified cardiologist and NewsNation medical contributor. Doctor, first off, children getting kidney stones, this is alarming. Is this a trend you've noted as well?
Yeah, no, I mean, to your point, good morning to you, Kelly, and Happy New Year. To your point, this was a condition that was considered an adult's disease. But the research is showing that over the last 3 decades that there has been a big dramatic increase in kidney stones. And to your point in the lead, it's ultra-processed and processed foods, because when we hear the word processed, what are we thinking? Extra sodium, extra sugar, things like phosphates and sodas and processed cheese. That's what's driving, at least some of the researchers think, these kidney stones in kids.
So I'm big on actionable items. What can we do to avoid this? How much, doctor, is diet a factor in these cases versus family history or possibly not drinking enough water? And then we'll get into the specifics here.
Yeah, no, I mean, I think it's a combination of things. I think that big dramatic increase that we've seen over the last few decades is driven mainly by our diets. There is some genetic form of it. So some families just make more kidney stones. That's a different story. But the things that we're eating in our diet, so for example, the ultra-processed foods that contain a whole lot of sodium, when there's sodium in the diet, it actually makes more calcium in the urine. Calcium is what drives a bunch of the kidney stones. The same thing with sugars. And so we know it's the diet that has changed over this short period of time.
Yeah, so let's drill down here. The CDC finds 75% of children exceed the sodium intake guidelines, and the agency found that half of young adults now have at least one chronic condition. That is staggering. Doctor, how much sodium becomes a risk factor in all of this? How can we track it and make changes?
Yeah, quite frankly, as a cardiologist, I know that we eat way too much sodium in our diets. And some of the research and some of the quotes have been that while the recommendation is somewhere around 2,000 milligrams a day, which I think is high, that our adolescents are getting 3,000 or more, depending on how much fast food they eat a day, which actually not only raises your blood pressure and increases other risk factors down the road, but gives you a risk for these kidney stones. And let me tell you, having taken care of people with kidney stones, this is not something you want to play with. So it's something for us to pay attention to.
Yeah, it is serious. We have about 30 seconds left, but we're flashing these images of donuts and everything you can imagine. What are some foods that you think people need to avoid or cut back on that maybe they believe are healthy choices?
Yeah, so, in particular, people who have a tendency to form stones or who've had a history of stones, fun things like chocolate, here I go, dousing people's dreams with the health information. But chocolate, sweet potatoes, some of these things actually increase the oxalate, which is the other thing that forms the stones. And just in general, the sodium in your diet, whether you add it at home or you get it outside, try to reduce that. Hydration is the key. And here's the last one, Kelly. Don't overdo vitamin C. When you overdo vitamin C, you form more oxalates. You form more stones when you have more oxalates.
A balanced diet. All right. Dr. Dave Montgomery, Happy New Year to you, and thanks so much for being here. We always appreciate it.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.